Good afternoon, everyone. Thank you very much, dear ladies and gentlemen. Thank you for the invitation to take part in this international conference. Over the decade in the digital technology, I'd like to today share some insights in our experience in Kyrgyzstan. We have embarked on a transformative journey, advancing in critical national systems like unified biometric database and comprehensive state registries. I think this is the foundation for any kind of digital solutions which are used in our governments. These systems have developed the governance and significantly enhanced the services we provide to our citizens. Our most ambitious journey has been Tunduk, a national interoperability platform, and this platform has been implemented based on the Estonian interoperability platform called X-Road. Tunduk now seamlessly integrates over 200 organizations from the public and private sectors, fostering unprecedented level of data exchange and forming the backbone of our digital infrastructure, boasting over 1 billion data exchange transactions. A key success of Tunduk is its integration with healthcare data, revolutionizing digital medical services and citizens' engagement. Reflecting on the past 3 years, it's remarkable to consider that health e-services, including online access to patient data, were virtually non-existent. This was due to 3 factors. One of them would be minimal public demand, the absence of regulatory healthcare framework, and insufficient infrastructure. Patients' reluctance stemmed from concerns over data security and a lack of trust in state-run systems. The healthcare sector's regulatory gap was linked to limited expertise and a focus on digital processes without a holistic digital transformation. And the third challenge, inadequate infrastructure, was a result of these issues, as there was little incentive to invest in digitalization under these conditions. To overcome these hurdles, we embarked on comprehensive 3-year digital health strategy, emphasizing a person-centric approach and data-driven decision-making. The COVID-19 pandemic acted as a catalyst, accelerating the shift toward digital health services, including remote access to patient data like lab results and vaccination records. This shift not only streamlined healthcare delivery, but also led to significant cost, a time saving estimated of $220,000 in 30 years. A key solution was simplifying the process of acquiring cloud digital signatures through mobile apps, which led to a significant increase in their issuance. This move, underpinned by a robust state identification and authentication system, significantly enhanced the security and privacy of patient data. We then introduced a digital health profile for each citizen, a specific version for minors accessible to their parents. These profiles contain comprehensive health-related information, such as insurance details, vaccination history, test results, e-prescriptions, and healthcare visit records. This initiative not only promoted transparency and public oversight, but also empowered patients to manage their healthcare finances effectively. Additionally, it enabled patients to manage their health insurance directly via mobile app. On our healthcare financing model, which combines per capita funding for primary care and case-based funding for hospitals, further underscores the importance of this data access. It allows patients to actively engage with their health information and related financial aspects. Moreover, integrating patients' data has improved the accuracy of civil registration, vital statistics. For instance, the recent comparison of newborn registrations in the health system and civil records revealed the 10% discrepancy favoring the health system. This insight has been instrumental in refining digital documentation processes for newborns. To support these advancements, we developed our first regulatory framework for telemedicine and are working on interoperability standards with the private sector. These efforts have made health services one of the most popular services in our country. While we focus on innovation, we maintain strong commitment to data privacy, safeguarded by the digital signatures, ensuring that data is accessible only to its rightful owners. As a responsibility, particularly in data privacy, our GDPR-inspired data protection law and the State Data Protection Authority are steadfast in guarding our citizens' privacy. Furthermore, our digital services portal empowers citizens with transparent access to their data processing records. Every citizen they can have and monitor who, when, and what data have accessed and how they process those data. As we move forward and are dominated by AI and Web3 technologies, we are adapting and responding with appropriate legislation is crucial. My latest venture, My Data Coin, states at this crossroads, combining the necessity for privacy with the opportunities of data monetization through blockchain technology. In conclusion, I firmly believe that the state role is to cultivate the best legislative, technological, and ethical practices in data management. As we navigate this ever-evolving landscape, and our commitment is to strike a balance between innovation and the rights and needs of our citizens. Thank you for this opportunity to share and collaborate on our journey towards a brighter technology-empowered future. Thank you very much.
So, Salim Hashim here, I run a healthcare management company in the US. So, one of the things you brought up, which is really important, is your country is developing a population health-based strategy, and you're also working with the private sector to build your interoperability. So can you clarify that? Because at some level, the public sector, private sector are complementary, and yet private sector operates the way it operates. How are you encouraging the private sector to start to work to build these interoperable standards? Because if you have one source of data which people can access, whether they go public or private, I think that's a great leap forward. So how are you actually motivating and incentivizing the private sector?
Thank you very much for this question. I think the answer is simple. Because the private sector, they mainly request their clients or patients to bring verified by government agencies some kind of documents. And it's usually paper-based. And those paper-based documents, they're usually issued on there's a fee to get that kind of document. It could be any kind of certificates, any kind of proofs, etc. So once the private sector integrates into our unified interoperability platform, it's free of charge, and they can get access to the data by the consent of the citizen to any data which is kept at any government agency. So this is the incentive number one. And second, now the Ministry of Health of the Kyrgyz Republic, they have adopted health data framework, which is mandatory for every private hospitals to integrate and to be part of that ecosystem. And it is done in order to push the data exchange in electronic version between the government hospitals and private hospitals in the best interest of the patient. So I would say that the first motivation would be there's an economic incentive behind it, and second would be the legal framework is also developing in order to meet the interests and requirements of the government and in the best interest of the citizens.
All right, ladies and gentlemen, thank you very much, Dastan Dogoev, for joining us all the way. We wish you a very quick and speedy recovery as well. Thank you very much. We'll say a goodbye from Pakistan now. Thank you.